is John Bacci. He's the Executive Director of Pathology at Boston Children's Hospital, Harvard Medical School, and the Chief Operating Officer of the Children's Hospital Pathology Foundation. His current position involves comprehensive academic, medical center administrative, financial, technical, and facility management over all anatomic and research pathology divisions. John concurrently functions as the Chief Operating Officer for a not-for-profit corporation, serving as a strategic administrative partner, reporting to the President and the Board of Directors. John has held leadership roles in virtually every national pathology organization, including the ASCP, the American Pathology Foundation, and the APC. His 41-year career in anatomic pathology began as a histotechnologist and a pathologist assistant, and this was before the PA certification designation. He's been a member of the ASCP, as he put it, simply forever. So we're really pleased to have John talk to us today about this wonderful program that they have going at Boston Children. So take it away, John.
Excellent, folks. Thank you very much, Dr. Harrington. I'm going to share my screen. And can you folks, can everyone see that okay?
Yes, we can see it.
Excellent. So many thanks to the ASCP for organizing this, and even a much larger thanks for their amazing support for these workforce initiatives. They are certainly the leader with this, and it's always a pleasure to be part of programs like this. And also with my new best friends, Joetta and Terry, that are going to follow after. I think the ASCP did a very good job in putting our Boston Children's internship first. Ours, we joked about this in practice, ours is a bit of a lemonade stand approach to these. And when you get to Terry and Joetta's, that is the Amazon way of doing this. They have a much larger, well-organized wheel, and I was very impressed to see that. I'm sure you will too, but mine will serve as a kickoff. So here we go. I appreciate the introduction, and I have nothing to disclose. And we're going to jump right into this. And I thought it would be prudent, and I agreed with the group that I would sort of memorialize all the amazing work that's been done by the ASCP up until this point to promote these laboratory workforce issues. And thanks to many of the folks that are hosting this call, they summarized the laboratory workforce, and these 3 slides are worth going through item by item. Obviously, we all know that we have a diminishing level of critical personnel in all of the laboratory subspecialties, and a declining number of accredited education programs feeding them. There is a decreased interest in STEM students, and that results, of course, in increased demands on our workforce and increased vacancy. And obviously, there's an increased need for diversity in all areas of the pathology laboratory workforce. So what Edna and a lot of the ASCP colleagues have done, they put together this wonderful document that summarizes a blueprint for action. And I'm guessing because you've signed into this webinar, you're interested in supporting that blueprint. And they have 12 marching orders that we should all try to follow as best we can, starting with, we all need to work to increase the clinical laboratory career education, exposing folks even at the elementary, middle school, high school, and college level to all the wonderful fields in laboratory. We need to do a better job in promoting visibility of clinical laboratory occupations in all levels of education, and support education programs and offer our institutions as clinical training for those folks fighting hard to sustain their accredited organizations. We need to promote consistent use of occupational titles and roles so people know who we are and exactly what our titles are, refine recruitment strategies to find these folks, encourage professional development, and once we get these great people, promote better job satisfaction. We need to examine opportunities for on-the-job training, and that's important nowadays because as time goes on, we're going to be taking more and more uncertified people and trying to help them get their certification on the job. We need to promote diversity, especially in the academic recruitment, and encourage our employees to increase all of their diversity initiatives to fund qualified candidates to our industry. I'm guessing that because you folks are here, we're all going to be part of this nationwide coalition and campaign for action that would support promoting careers in laboratory into the future. In your own institutions, we are going to encourage you to form some sort of workforce steering committee to periodically get together and discuss and address these issues. And like we do for everything in the laboratory, we do nothing without funding. And just like we fight for capital and minor equipment and reagents, you're going to try to secure a little bit of funding to put aside a small amount of funds for this initiative as well. So the reason why I am here, as Dr. Harrington suggested, is for about 14 years now, we have had a very successful internship program, mainly focusing on high school students, but occasionally college students here at Boston Children's. And it started with a personal story, as a lot of these internship programs do. I live out in central Massachusetts. I'm somewhere between 35 or 40 miles away from Boston where I work. And for a while back, I was a single dad of 2 daughters. And my daughters went to very rural high schools out in central Massachusetts. And here I am in Boston working with Simmons College and Boston Latin right near us, close by at Boston Children's, and seeing all of these great high school kids coming in, but no one was approaching my own children's school out in rural central Massachusetts, small towns. And after talking to my kids and their students, you realize that these employers are literally starving for some sort of corporate attention, and they don't have any exposure to hospitals and corporations that are willing to do something like this. So it was frustrating for us. It was frustrating for me as a parent that I was reaching out to Boston Latin schools, which are right next door, or Brookline High School in Massachusetts here, again, very logistically close, but no one was reaching out to my own student schools. And the STEM programs were starving for this, and they were suffering because they had no employer to help sponsor them or support them. So I bolded that blue line because that line's important, and that's on this slide, and that's how this got started. I called my daughter's high school principal to discuss if he would be interested in setting up some sort of affiliation. It's a wonderful gentleman, Mr. Clemens. The reason why I'm still here doing this was his excitement. He literally jumped through the phone, and he said he would absolutely love to do something with Boston Children's Hospital. And we met shortly there afterwards. So it started out, I offered to give a lecture in anatomic pathology to their science department. This lecture turned into a full-blown lecture in the gymnasium with all of the science students and most of the teachers, and parts of the school committee were in attendance there. And I gave maybe an okay lecture on anatomic pathology and all the different jobs available in anatomic pathology. And when I was done, one of the teachers teased me a bit, saying, boy, it sure would be nice to have a field trip out to your hospital. So we talked more, and it wasn't very long there afterwards that in the top right side of the picture in this slide, that's a picture of Nipmuc High School in Upton, Massachusetts. And that's the Laidlaw school bus that took those 10 students there to a field trip on a Saturday at our hospital. And they spent a day with us. And we walked the students through our department as if they were a specimen. We started in the grossing area, then the histology laboratory, and then molecular, and then all of our ancillary laboratories and the morgue. And while we were talking, a lot of the students expressed some sort of interest in doing an internship at our department. So hearing all these internship inquiries, when I got back to work that Monday morning, I sent an email out to our department, especially the medical staff, asking folks if they would have any interest in high school students coming and spending some time with us. And in blue there on this slide, you'll see some of the responses that I got. And it was things like, can they help catalog research articles or organize supplies in our laboratory, or sorting manuscripts, filing research slides, and are they good in Excel? They can help me with the database, and can they even just help me organize my office? So the high school that I talked to 14 years ago, I still have a relationship now, and they still send students to us 14 years later. So that's just a very simple story on how this started. So if you're interested, it's really that easy. Again, this is very much a grassroots, small town lemonade stand approach to starting this internship. But here is what you'll need. obviously you need executive approval. You need your chair, your vice president, your senior vice president, the president of your private laboratory to support all of this. And second, and of equal importance, you need a core of passionate employees who believe in this profession and are genuinely interested in mentoring and giving back. You cannot do this with some of your more sour employees. This has to be folks that are really passionate about the laboratory and passionate about mentoring. And then the next step is easy. Just do what worked in our area and just make an outreach. Outreach to your high school principals, your local STEM directors, science teachers, your college medical science program directors, if they have an MLS program, job fair organizers easily found in a Google search by state, your own alma mater or your children's schools. What I can guarantee you folks is they will not say no. They are starving for this attention, and they will eventually become your ambassadors, because after having an affiliation with a lot of these folks, I have learned that they too need to do this as part of their educational initiatives. These schools have to have job placement requirements for their students, and they have to check a lot of boxes with community outreach. So I can guarantee you no one is going to say no to your offer. So once you reach out to them, you need some sort of advertising. You need to follow up with something a little bit formal. We developed this summer internship advertisement template sheet. This was made with our marketing department and one of our fellows that didn't mind having his photo taken in 2010. For you lab folks out there, especially the anatomic pathology folks, if you look closely, you'll notice that this photo is actually our morgue, and this is our morgue table. And Alex Williamson, who was one of our fellows back then, took one of our physicians' microscopes, and we backlit the morgue in blue to make it look a little more glamorous than it is. And this has been our advertisement for 14 years for children's pathology summer interns. So once we make that outreach, we usually PDF this out, and we still hard mail them out to high schools in the area. And that's all it takes for us now to get folks contacting us for summer interns. Interns apply. Again, this is a very small town way of doing this, yet still very effective. It's a very simple application that we ask students to fill out. We usually work with all the universities to help them to narrow down who they also think are qualified candidates. And this also gives us a database of who to call, what their phone number is, what their email, emergency contacts, and things like that. You do not have to make this difficult. We ask the students to write a small essay on why they'd like to be an intern, and that helps us pick now from who we're going to select. Each institution, of course, and you folks will know this in your own institution, there's onboarding basics. We have to bring people in as what's called associated personnel, and that gets them IDs and security access and a badge. But all institutions are different. There's different security requirements and vaccination requirements, and I'm sure there's someone in your department or in your hospital human resources that can help you with that. That's obviously mandatory to bring anyone in your institution in a formal fashion. And a simple schedule. And this is an example of our very, very simple schedule. We expose the students to all aspects of our laboratory, even administration, and they're here for 1 month. Typically, our internships are about a month long. They spent a week in the grossing room in the autopsy suite and the histology laboratory, in the molecular lab, and a week in administration. And then all we do is switch. So Ariana, the next week we'll kick off starting in histology, and so on and so on. We also invite all of our interns to department lectures when the person given the lecture gives permission. And so we will tell them in the morning, hey, 11 o'clock, wherever you are, go to the library. There's going to be interesting case conference. And they all go into the library. And that seems to be a big hit to immerse them in more the clinical end and the medical staff end of this as well. So a simple schedule is all you need. And then once you have everything, you can use these schedules year after year after year and just change the name. So cost. Prior to the pandemic, we were not paying summer interns, and we were getting plenty. After the pandemic, it seemed like it was definitely a trend to start paying for summer interns. And we were competing a lot more for folks that during the pandemic were a bit stagnant, and now we're getting into mentoring and student development a little bit more. We're in downtown Boston. It's very expensive to commute here and even more expensive to park. And we did a lot of research and realized that the hourly rate that we pay our summer interns, though it's high at $19 an hour, remember, you're trying to convince a high school student to take 1 month out of their 3-month summer and come to you. And many times that might preclude them from a 3-month summer job. So we played around with hourly rates, and this is the rate that's working right now. We asked our summer interns to only work a 6-hour shift, and that helps them avoid the commutes in the morning and in the afternoon. So they start around 9 and they leave around 3 p.m. But the other thing this is going to cost you, and I'll go through the details in a minute, it's a little bit of time, folks. It's time for planning and communication and intern management. Someone has to take care of the onboard mandates, of course, and that's in advance of their arrival. And usually have folks helping out with schedule with minor supervision. The payroll you'll see below for a 4.2-week internship, it's at $19 an hour. It's a little over $2,300 in salary. And if you use a regular, say a 20% part-timers fringe benefit rate, you can see what that equates to. We try to help them out with parking and food a little bit. So for a 1-month intern, it costs you about $3,200. I would encourage everyone here, when you're asking for this, and I put that in red to bring special attention to it, try to ask for your vacancy money. Try to keep track, even if it's a small Excel spreadsheet, on folks that have been out of your department and folks that jobs you haven't filled yet at any level of your department. Remember, those are FTEs that have been approved by your budget. So when your budget folks approve an FTE, they approve it for 12 months. If you have a person that's only been there 11 months, you have 1 month. And that I would use that as your initial ask, that you're not asking for more money, you're asking to spend the FTE money you've already been allocated. And at $3,200 for a month, that's a pretty insignificant rate if you add up all of your vacancies. These students or these interns do require a little bit of a touchdown space. We have a cubicle farm where we assign all of our interns, and that gives them a PC and a small place to call their own. And again, a little bit of parking and food and minor amenities, and we usually give them a coffee mug or something like that to leave with. And last but not least, you're going to write a lot of college reference letters. They will keep your name and email, so set up a good solid college template because you'll be using it. What an internship program will provide you. So what this right now, our internship pipeline is as strong as our human resources department when it comes to recruitment. I save the names and the emails of all the interns that we particularly liked. And when we have a vacancy, knowing that now they've graduated from college and they have biology degrees or chemistry degrees, I reach out to them and I ask them if they'd like to interview for one of our roles we have here. So it does create a very, very strong pipeline of employment for your technical and administrative areas. It supplements human resources. Some folks have really good HR recruiting and some don't, but without a doubt, this is a supplemental group of people that you can either direct human resources to or reach out to them yourself. It creates a great internal and external marketing for your department. We make sure the hospital knows we do this. We take lots of pictures. We post them on our hospital website. We make sure we post pictures on local newspapers where the interns are from. It has really been a great public relations issue for our department. It creates a wonderful word of mouth campaign. We now have several high schools. These principals all talk and the science teachers all talk. And now we have so many intern applicants that we don't reach out usually anymore. We have folks reaching out to us. Our biggest problem right now is saying no. That's how popular it's become. It's wonderfully gratifying. There's not many things in the laboratory world that we do now that's a win-win, but this certainly is. It's a feel-good kind of a thing to do. It's great to support the ASCP's initiative in supporting the national lab crisis that's going on right now. You'll see in a couple of slides that it can reach out to support your communities as well, and I have examples of that. And best of all, you'll complete a lot of projects, and especially a lot of projects that some of your existing full-time employees might be hesitant to do. These high school students don't balk as much about menial projects or database projects or things that might require a little bit of manual work. And it's just been terrific for us. Our actual results speak for themselves. In 14 years, we've generated a physician who's a pediatrician now at UMass, a pharmacist, 6 pathology assistants, 5 histotechs, 5 lab techs, a medical examiner technician, a financial analyst, 2 healthcare researchers, 3 administrative associates, a billing and coding specialist who works for us. And we have changed the major of 27 students who came here and decided they wanted to go into the sciences and made sure they changed their major to biology or chemistry. That red asterisk that you see on this slide is also very, very important because all of those folks at one time or another worked here at Boston Children's in either a part-time or a full-time basis. So that's helpful too. As far as community benefits, one of our high schools, Hopedale Junior Senior High School in Hopedale, Massachusetts, was recently recognized as one of the 7 blue ribbon education schools in the state of Massachusetts. Washington, D.C. has a committee of folks that designate certain high school as blue ribbon high schools based upon their community outreach. And I went to the ceremony where this school was inducted into this blue ribbon class, and they cited their affiliation with Boston Children's as one of the unique reasons why they were selected for this designation. Also, this same school, at one time, they were trying to obtain funding for an anatomage virtual dissection machine, and we also accompanied them to school committee, and they got approved to have this virtual dissection machine at a high school. There's a lot of medical schools that don't have this, and this high school has it. And we'd like to think that part of that was their affiliation with us. So this is just going to be a wonderful anatomy and physiology tool that will constantly help only us as well too, as they feed their best students to us as interns. That's the end of my presentation here. I cannot encourage you folks to make the call. It's really, really simple, and I've tried to show just how simple it is. And with that, thank you all very much. And I'm going to turn this over to Terry and Joetta, who are going to show much, much larger recruitment efforts that they take. And thank you very much. It's been an honor. Thank you, Dr. Harrington.
Yeah, while Terry and Joetta are getting their slides ready, I'd just like to introduce them. And just to mention, if you have questions, you can put those in the chat. We're monitoring the chat, and we'll save all the questions till the end. So let me introduce Terry first. Terry began her career as a medical laboratory scientist, primarily in hematology and blood bank, before embarking into the teaching profession. She earned her bachelor's degree with a minor in education. She also holds a master's certificate in executive leadership and healthcare administration and a master's in health. In 2000, she began her teaching career at a local medical and technical career school, educating students in courses for phlebotomy and the medical assistant technician programs, where she found her home in the classroom. In 2009, she became the program director and principal instructor for the Geisinger School of Phlebotomy, which has held NACL's approval since 2013, and they'll tell us more about that. In addition to her administrative and teaching duties, she's the ops advisor of the best practice team for phlebotomy at Geisinger, and she chairs the advisory board of their School of Phlebotomy. Terry is also a member on 2 CLSI committees for pre-analytical processes and blood collection practices, and she's a program educator for the NACL's Program Accreditation Review Committee. Terry holds professional memberships with ASCP, CLMA, and ASCLS. And let me also introduce Joetta, who works with Terry. Joetta has an associate degree in science. She began her laboratory career graduating from Allied Medical and Technical Careers in Scranton, Pennsylvania in 1992. Joetta worked for a privately owned laboratory in Scranton through the 90s and the early 2000s. Joetta has been working for Geisinger since 2009 and received her ASCP certification in 2015. Over the years, Joetta has assisted in many roles within the Geisinger system, and this has allowed her to gain her useful knowledge. She's began as the site instructor for the Northeast campus and assisting Terry at the Geisinger School of Phlebotomy in July of 2021. So if you want to share your slides. You ready?
Terry should be working on that.
Okay.
There she is.
There it goes. Sorry, I was having video issues here. Thank you.
Okay.
Thank you, Dr. Harrington. Appreciate that. Good afternoon, everyone, and thank you for joining the ASCP webinar series, Grow Your Own Laboratory. So I'd also like to take this time to thank ASCP for inviting us to speak on this topic. And today we're going to discuss how to implement your own hospital-based phlebotomy program.
Terry, I'm not seeing your slides. The green share button at the bottom.
It's on, let's see. Can you see it now?
No.
All right, what is it doing? I have share screen. Okay, how about now?
No.
Oh, what is it doing? Now?
Mm-mm.
Why isn't it sharing?
It's okay. Take your time.
There we go.
There it
Oh.
goes. Oh, I must have hit that same button like 3 times here. All right, well, thank you, everyone. So as Dr. Harrington mentioned, I'm Terry Macklin. I'm the program director here at our Geisinger School of Phlebotomy in the central region of Pennsylvania. And my colleague Joetta, who will also be presenting with me today, is our site instructor at our Northeast campus. So welcome, everyone. So a little bit of history about our program. So our program launched back in 2009 after talks began with our laboratory management team about the turnover rate that we were having in phlebotomy, which was averaging about 25% yearly. So of course, with that comes the cost, which we estimated about 1.5 times the salary of a phlebotomist to take them off the bench now to train those new employees. And so at this point, we're spending all of this time. So it's, of course, time consuming, not very cost effective, as it's taking us like 8 to 12 weeks to train these new employees on our policies, procedures that they may be lacking, and the computer functions due to the caliber of those candidates that were joining our workforce that came out of school inadequately trained with their phlebotomy skills. And now this is adding additional time for us to onboard each new employee. So how did we get this started? How did we implement this program? So management decided to start with one full-time program director and instructor, which was myself. And then we also hired a part-time administrative assistant. So while the PD had both teaching and management responsibilities, the admin was responsible for onboarding the students with HR. She was preparing our PowerPoints we made, our tests, our handouts, and then, of course, developing any of our program surveys for our employers and our students for feedback that were designed for our program. So for our program length in our classes, we chose 15 weeks to kind of align with the average college semester. And at that time, we only had 2 hospital systems, so we were hosting 2 cohorts per year. You're also going to need to decide on your space. So you need to determine the size of your classroom, if you're going to accommodate desk, have a student laboratory, where you're going to keep your supplies. And then, of course, what is the number of students that you can fit in that particular classroom space? So we started off with 9 to 15, and we based this number based on our openings for our healthcare system at the time. So now we can move on to expenses. So of course you need to include the salary of both your program director and your administrative assistant. Some places do choose to have a program coordinator to handle other program duties as well. You need to take into effect that you're going to need equipment. So you're going to need computers if you're going to be using like an online format for the students to take their test. You're going to need safety drawing chairs, training arms or training blocks for venipuncture practice. So one of the things that we did is we were able to utilize our hospital and our clinics, and we kind of took all of their expired tubes off their hands. And so that way we can use these for venipuncture practice in our classrooms. And then of course we got other training supplies sometimes from our manufacturers. They gave us other little tools for the trade that we can use in our classroom environment for training. Then of course you'll have your supplies that you're going to generally need every day. So your general venipuncture supplies for gloves, needles, alcohol, etc. All those things for part of the blood collection practices. So now on to our teaching resources. So you're going to need to select your textbook. So I had chosen the phlebotomy handbook that was written by Garza Beacon McBride. Ruth McCall also has a wonderful text called Phlebotomy Essentials. And we also decided to subscribe to the Center for Phlebotomy Education and their phlebotomy channel to use as an additional teaching tool. So they have videos out, they have something called ATMs, which are abbreviated teaching modules that can correspond to your chapter contents that you have for your program. We also ordered Order the Draw pens and Order the Draw badge backers for our students, just to kind of have something else to give them for the learning process. We've also reached out to 2 manufacturers. A lot of times they'll have posters, stuff on information for tubes that you can share with your students. So anything you can kind of get on the freebie side, please feel free to reach out to those 2 manufacturers like BD and Griner Bio One, as they were very helpful to us when we started onboarding our program. Another thing you can do is choose additional faculty. So rather than just your program director and an instructor, we've utilized both our pathologist and our doctoral leads to present lectures on their given area of expertise. So let's say for microbiology, we had our doctoral lead come in and discuss blood culture procedures and why that's so important to follow that. What are the contamination rates and how do they affect our patients? From missing sepsis if you underfill a bottle, or how those other bottle fill rates can really affect those test results. For pre-analytics, we included our doctoral team members for heme, coag, and chemistry, and showing that how those tests can really be impacted by how the phlebotomist collects those, the temperatures that they send their tubes down to the laboratory with, and of course, anything that we're going to use that's going to be erroneous with regards to how those are transported, if it's like a walk to lab type of thing.
So we do have a unique model here at our facility. We post for a student phlebotomist on the hospital website every 12 weeks. We are currently holding 4 classes a year on 2 campuses, so we have lots of postings. We also do post on Indeed, another outside website. The interviews are usually conducted by the program director and phlebotomy management personnel. The students are hired as a student, but they are also considered employees. So they are flex employees. They do not receive any benefits during their training. However, they do get paid 1 pay grade less than a phlebotomist 1. So our phlebotomist 1s are phlebotomists that have less than 1 year experience. Once we go through all of the offers, which we do get over 100 applicants every semester, then we make our offers. So as you can see, here are some applicant counts for the last 4 years. So 2020, there were only 2 classes that Terry had in the central region. I came on board in July of 2021. So we had 6 classes. I ended up doing a July and September class. We had 6 classes. And then in 22 and 23, you could see that we had 8 classes. So in the central region, there were 4 classes, and in the Northeast, there were 4 classes. Okay. So the interviews are done by peers. They're team leads, supervisor, pre-analytic specialists. So we look at the applications, look at their job history, see if they have any customer service skills, and we take approximately 60 to interview. So when we're deciding how many people we need, it is based off of the open positions at the time, but typically in the central region, they have 10 to 15 openings that we will take, and that's going to feed 5 hospitals, over 20 clinics, and 1 mobile team. In the Northeast, I usually accept 9 to 12 students, and that's feeding 3 hospitals, over 20 clinics, and 2 mobile teams. Once we have decided on who we would like, the school will then forward to HR to begin the onboarding process. So part of our onboarding process is doing the clearances, your child abuse, your background check, drug nicotine screen, and immunization review. We do this now as a student, so by the time they graduate, we already know that they've passed everything and they can go directly into their new position. They graduate on a Friday, they start their new position on a Monday. So as you can see, with so many classes throughout the year, we have a continuous flow of graduates. So it has decreased vacancies system-wide. So from 20 to 22, you could see not everyone accepted positions. Some of those reasons could have been pay, it could have been the shift, and then a lot of people did go on to further studies for nursing and radiology studies. In 2023, we started to implement a contract. So therefore, everyone who graduated was guaranteed a position and they accepted a position. So Terry's going to discuss this further in the presentation. So some of the benefits to the healthcare system by having the students become employees, we've already done their background checks. Therefore, we don't have to worry if someone fails them after graduation, they can go directly into their new position. We also train the students to CLSI standards, and we teach them blood collection policies and the Geisinger computer functions, which we currently use Epic and Beaker for our laboratory. So clinical placement for phlebotomy programs, sometimes it can be hard to place students in their clinical rotations. We have so many options available that we never have to worry about that. The students don't have to look for it. So we put them through any of our hospitals, all of our clinics, and all of our mobile sites. The one benefit to our program is that we are NACLS accredited. It is a very high standard and it is a very well done program. They learn a lot. So NACLS does require us to have at least 100 clinical hours for the students. We give them over 200 clinical hours throughout all those different clinical types. As far as venipunctures go, NACLS requires them to have 100 unaided venipunctures. Our students average over 200 per semester, so they get a lot of experience going through our system. So to assist in their clinicals, we have what we call phlebotomy 3 preceptors. These are phlebotomists that have over 2 years of training. They have passed their ASCP board certification. They also must take a preceptor training class, and every year they take a preceptor competency exam. So by the time they're all finished with we are currently now at 12 weeks, Terry will discuss, they have done all their didactic clinical components and they are well versed in all aspects of blood collection practices and computer functions.
Right.
Oop.
Sorry, went backwards.
There we go. Okay. So while the students are still in class, by week 7, we actually start doing an interview day where they get to meet with all the managers, and the managers will discuss all their open positions. So it's one-on-one interviews on a specific day, and the managers tell them positions, the shifts that might be open, if there's any incentive to do second or third shift. Some of our harder to fill phlebotomy positions might even have a $5,000 sign-on bonus. However, this is good because they are all able to apply within, because they are all Geisinger employees at this point. After that day, they'll apply for any of the positions that are of interest to them. And one of the other things that we have the preceptors do is every time they have a student at their location, they must fill out a review on them. This allows us to see their progress from their first week of clinicals, where they might still be nervous meeting a patient for the first time, as opposed to the last day. However, if anything of any urgency needs to be addressed, it is addressed immediately. Also, the managers will get feedback from their preceptors, seeing how are they with customer service? Are they good at their sticking? Do they look knowledgeable? Do they seem interested in this? So that gives them some help when they're deciding who they want to pick for their open positions.
So now on to how we hire our graduates. So offers will begin for management to the students that basically apply to their open positions. So Joetta already mentioned they interview in week 7, and then in week 8, the students have begun to apply to those positions, and then selections are made. So the students with positions will begin to onboard during those final weeks of their rotations. And this really helps us because it eliminates that additional time to get all of our graduates signed off in their different areas. So particularly for our hospitals, we have 3 very large hospitals that are trauma centers, level 1 trauma centers. So the phlebotomists are assigned quadrants. So they might be assigned to ICU or CCU or emergency room or a children's hospital. And so by having this additional time spent during the onboarding process for those graduates, it really helps to shorten the time that they can be on their own once they get out into the workforce. So this is just some of our program statistics. So one of the things that NACLS requires is that we make our program very transparent to the public. And so we must post our program outcomes for any prospective student that's looking to get into our School of Phlebotomy. So right now we currently hold around a 95% graduation rating with a 90% placement rating. And across the spectrum, we have had from the inception a 100% pass rate for the Board of Certification for the PBT exam. My apologies, my 2022-23 statistics looks like they dropped off the page there, but we do have a 100% for the 22-23 timeframe as well. So what is NACLS? So we kind of been talking about this kind of through the presentation. So NACLS is the National Accrediting Agency for Clinical Laboratory Sciences, and they basically accredit laboratory science programs. So phlebotomy, MLT, MLS, etc. So this is strictly optional for your program. This is not something that you have to do. Currently, there only are over a little 50 programs in the whole United States for phlebotomy that actually hold this national accreditation. So there is a cost to it though. So there's a cost for the application fee, for the annual accreditation fee. There'll also be a site prep visit fee on the year you're going to be getting your site visit. And of course, the actual site visit cost for the reviewers to come and see your program. So it's kind of like an internal audit. So basically, you'll be writing a self-study that addresses all of the NACLS standards. And then in 2023, the phlebotomy programs went from an approval process to an accreditation process. So now we hold accreditation status, just like all of the other lab science programs. And so this will be done for the site visit now, starting in 2023, so that after you submit your self-study, you'll be having a site visit from our reviewers come to see your program. One of the other requirements is that you have an advisory board. And so these are individuals that you're going to select who are going to be able to review your program surveys. So your graduate surveys, your preceptor surveys, our employee satisfaction surveys, and give you relevant information on the feedback from them, and then how can we change anything perhaps in our curriculum that they feel that might needed to be addressed at that time. We used members of our staff. So we picked our laboratory supervisors, people who oversee phlebotomy, our doctoral leads, pathologists. You can even choose a member of the public who has knowledge of laboratory medicine as well to come and be on your advisory board. And then, of course, your website needs to have your program outcomes on. This must be available to prospective students who are looking at your program. So, of course, we have to put our last 3 years of our program outcome on our website. So how has Geisinger grown? So we've expanded a lot since 2009. So by 2013, we had already acquired 3 more hospitals. And so then we decided to have 2 classes up in our central region and 1 in our northeast part. So we would have 3 classes a year. And then, of course, as everyone knows, COVID hit. And this brought many vacancies across the healthcare spectrum. As most of you know, there was a mass exodus of employees. Since the census was kind of low now, people were being sent home. There was a loss of hours causing departures. And phlebotomy being a patient-facing type of position, many of our employees left because they did not want to be exposed to COVID. So in 2021, we had to try to switch gears a little bit. And we decided to go to 4 classes. So we had additional hospitals now added. We were up to 9 hospitals we were feeding, over 50 clinic sites, and we had 4 mobile teams. So now to play catch up, we decided to shorten our program from 15 weeks to 12 without actually sacrificing any of our didactic hours. And we just took our clinicals and reduced those from 260 hours down to 200 hours. And so we're still actually exceeding the NACLS benchmark for our clinical program. We also decided to add on additional instructors. So that's kind of how I got Miss Joetta. So her and I take turns lecturing live on campus. And the other team that day will be on Teams so they can view the presentation. And that way we can still hold an interactive classroom between our 2 campuses. We also have days where we bring both campuses together, and so that they get to meet each other, get to interact, and we do special student labs during the times that they are with us together. In the afternoon, we both break. She sticks with her students at her northeast location, and I have my students in the central region where we stick and do student labs. So then in 2023, a new model began, and we decided to implement a student contract. And so after feedback from our managers that some of our students are kind of leaving after a year to, explore other options in healthcare, our HR team, along with our compensation department and legal, decided to create a contract where the students would now be committed to our institution when accepting an offer to the program, that they're going to work for us for 2 years following their graduation. So there's no money exchanged at that time, but we decided to place a value on the education that we were giving our students. So they came up with a rounded fee of $3,500, taking into consideration the salaries for the program, the textbooks, handouts, the supplies that you're going to need for teaching. And also we included the payment for the students to take the ASCP Board of Certification phlebotomy exam after graduation. And so now all the students must sign a 2-year commitment with us in a forgivable loan in exchange for that $3,500 subsidized education. So what they did is they created an amortization table over those 2 years. And so basically any student not completing their 2-year commitment will be responsible to pay back the remaining portion of that loan that is subtracted after each pay period they work. So like we said, there's no money up front. There's no money deducted from their paychecks. The money is basically deducted from the time that they work. So every hours they work, that loan just decreases as they put in their time. And so this also includes our graduates who decide to leave voluntarily or are terminated in the process of their employment over those 2 years. So what are some of the outcomes now for our program? So we get to be very selective in the candidates that we choose. We get over 100 to 150 applicants every semester. And we kind of have to narrow that down to our selections at both the Central region and the Northeast campus. We get to do their clearances right when we hire them. So we don't have to worry about educating these individuals and then finding out at the end we can't hire them because they don't pass those clearances. We get to train according to industry standards and our own healthcare system policies. So essentially for those 12 weeks, we are Geisingerizing them to our institution's policies. The plus for us, they graduate on Friday evening and can immediately onboard after graduation Monday morning into their new positions. So this has significantly reduced the vacancies that we have by just having this constant flow of graduates coming out of our program every 12 weeks. It's also given us a reduction in cost because now we don't have to spend that time to train these outside candidates who are poorly trained or maybe learned on the job and were not really proficient at their phlebotomy skills when they join our institution. And then finally, the repayment of the loan for those who failed to complete the terms of the contract. And so that way we are not taking people off the bench. For people who are lacking those skills, we get that little bit of that repayment back to us in the event that they do leave our institution. So I want to thank everyone for their attendance today. My email address is there. If you have any additional questions on implementing your own school of phlebotomy, please feel free to reach out to me. And I guess Dr. Harrington will take it back to you if there's any questions.
Thank you so much for that informative and I would have to say kind of inspiring presentation. It just shows how hard you've worked at putting your program together, both of these programs, and the amazing results that you can have from that. And it takes time. Both of you have been working on this for a long time. So I appreciate that. So we do have some time for questions. I have several of my own, but I'm going to go to the chat as well and see what we have here. So here's a question from the chat. Is there a progressive compensation plan for graduates, employees as they gain experience? I think this one goes to the Geisinger team. How would you say compensation compares with other health systems in the area?
So right now, I believe we're probably one of the higher paid phlebotomists here in our area. We have 3 levels of phlebotomists. So our students, as Joetta mentioned, come in as a phlebotomist 1, and those are individuals who have less than 1 year of experience. If you're a phlebotomist 2, which our graduates actually come right in as a phlebotomist 2, because we have a NACLS accredited program, we're giving them that bump up a pay grade and coming in as a phlebotomist 2. And so from that point, they need at least that, like I said, greater than 1 year of experience to be coming in as a phlebotomist 2. And then to be a 3, as Joetta mentioned, they need to have their 2 years of experience. They need to be PBT, ASCP certified. We do not accept any other certification in order to bump up to a preceptor role. And so we have those 3 levels of phlebotomist. And then from there, if they have 5 years of experience, they can move on to what we call a pre-analytical specialist in phlebotomy. And so that's kind of like their first step into management before they can become like a team lead or a supervisor. So we have a really great career ladder move for our phlebotomy program from inception as a student all the way up in 5 years to possibly being a team lead. So there's a lot of room for growth for our students.
Thank you. John, a question for you. So sometimes when we have students and trainees in the laboratory, there's a bit of pushback from the employees. So how do you have that where you are when you're assigning your interns to various benches, and how do you handle that?
When we first started the program, there was definitely a little bit of pushback and resistance. But what these folks have learned, and each of the laboratories have either a clipboard or they work with their supervisor for projects that they themselves may not particularly want to do. It might be something that's ideal for the interns. So it's gone full circle that the lower level laboratory projects that some folks that ruffle feathers, get saved for the interns. And that has helped out a lot. Every now and then we do get a little bit of sort of crustiness if someone is right there, especially when some of these interns comes in, and these young people are very technologically savvy, and all of a sudden someone is going to the intern for Excel skills that one of your full-time employees don't have. But we try to soften all of that to make sure everyone's getting along well. It's very few and far between. So
Thanks. I had another question sort of related to the internship program rotation. So like you showed that example of the rotations, do you take 4 students at a time and then they observe a certain bench or section for a week? And then do they do projects sort of in you know, a couple hours a day, or how do you fit in the projects versus that shadowing?
yeah, it's a great question, Susan. We you know, the work that sometimes it varies. For example, if by some chance they get put in the histology lab and it's late in the afternoon, usually histology at that point, they're doing maybe reruns of immunohistochemistries and things like that. So they're not plopped right in the middle of the morning rush. And that sort of tends to be project work, but we make sure they're in their respective laboratories right during rush hour. And that's a little bit more of the job shadowing. And then sometime in the off hours too for projects. And the folks are the folks in the respective laboratories that manage that are very mindful of that. That's a great question.
That's great. So let's see. So there were a couple of questions related to foreign applicants. I think these are for the phlebotomy program. So can someone apply for studentship from outside the United States? If yes, what are the requirements, especially being a medical laboratory scientist from a home country? So I guess, can someone apply from outside of the United States?
Actually, no one can apply actually outside of the confines of our area, only because they do have to attend live in person. We don't have a strict online format, and they do have to commit to Geisinger for 2 years following that education. So unfortunately, any of the students that would come here would have to commit not only to the program in person, so they could do their clinical rotations here at Geisinger, but then they would also have to work for us for 2 years following that graduation. So mostly it's just our local people in our 9 hospital areas that apply to our program.
Okay.
And for us, we have never actually had a outside US applicant. I think it's something, if someone was interested, I would actually run it by our international team to see what the restrictions are, if there are any. But that would be something I'd be willing to investigate further if anyone is interested.
So one of the things, I guess I just wanted to compliment you, the Geisinger program. I loved hearing that you have leaders from your various clinical lab sections give some of the lectures that are relevant to the importance of phlebotomy for that section, because I think that really helps them appreciate the phlebotomy school and the work of the phlebotomist, gives that phlebotomist exposure to the laboratory, and then also you know, I guess just helps everyone appreciate the other person's role and the importance of each person's understanding of that key pre-analytic piece. So I guess I just wanted to congratulate you on that as well.
Our pathologists and our doctoral leads are wonderful. They've put together some wonderful lectures for our students, and they come to the classroom, they're very engaging. And, you know, sometimes you think, okay, the phlebotomist are, you know, down here at the bottom of the totem pole and our pathologists are at the top, but they really kind of bring a unique, you know, perspective to the classroom, and kind of tell their side of the story of what they see on their side and how it's relevant, how those phlebotomists are really relevant to laboratory testing, and, you know, why that 70% diagnosis has come from laboratory test results and how do they impact that. So they've been wonderful in participating with us in our lecture series.
Yeah. Someone asked, this is for the phlebotomy program, how has the turnover rate improved since the inception of the school? You mentioned there being a big turnover rate during COVID.
Right. So now it looks like, I mean, we are still going to always have vacancies. And a lot of the times we see our students kind of moving on. We have I have 2 students who are physicians today. I have a couple that are PAs. A whole bunch of them went to nursing school. I have 2 that are respiratory therapists. One went to be a vascular technologist. So they see those other things. So we do still have people leaving. I think the last time I checked with HR, I think our vacancy rate was down to around 14.7%. So we've significantly dropped from what we were, back in 2009, when we just had that constant, in and out, policies where people were just coming and going at their leisure. So just a little bit more accountability now too. So we really want to make sure the candidates coming into our program truly understand, what phlebotomy is all about. How does that impact our patients? And as I tell my students every day, the decisions you make this morning will impact a patient's life this evening. So make good decisions, make good choices, and make your best practice your everyday practice, and then you will not compromise a patient's test results.
Well said. So we have to wrap it up now. I'm so sad to say I could talk about these things for a long time. Again, using that QR code that we showed at the beginning of the session, you can find the Grow Your Own webinar series at the ASCP website. And I just again want to thank all of our speakers. Thank the ASCP for organizing, and Edna Garcia, our chief organizer. So have a great afternoon. Thanks for participating.
Thank you all.
Thank you.
Thank you for your time, everyone. Have
Bye
a great
now.
evening.